This is a modern telemedicine practice. Patient intake, eligibility checks, and API integrations run instantly, turning smoothly with friction. But the moment a patient requires a medication that needs prior authorization, that automated efficiency stops. It hits a manual human bottleneck. For telemedicine founders who have built their entire operational model on speed, this administrative wall creates a friction that contradicts their entire model. Software can manage the schedule and the intake, but it stops at the pharmacy counter. This is where engineering meets the manual reality of insurance. According to AMA data, the average practice processes 39 prior authorization requests per physician weekly. This drains 13 hours of staff time, a day and a half of lost productivity, directly correlating with 89% of physicians reporting significant burnout. The business consequence is severe. Because of these delays, 82% of patients abandon their recommended treatment before ever starting. When a telemedicine growth model relies on rapid onboarding, a delayed prior authorization means a permanently lost patient. Every single insurance payer operates with entirely different, constantly shifting clinical documentation rules that are impossible to predict. You cannot code a script to schedule a peer-to-peer review with a medical director, gather evidence for step therapy rules, or execute the necessary follow-up phone calls. Scaling founders are forced to choose. They either absorb the high cost of hiring in-house specialists, or they watch their patients leave for competitors. A technology-driven telemedicine practice in La Jolla, California, hit this scaling crisis. As their patient base grew, they sought a different operational model. Telemedicine scalability requires acknowledging the limits of software. You have to deliberately insert a trained human layer that functions with the reliability of a software API. The La Jolla practice partnered with Staffingly. Within 72 hours, they deployed dedicated HIPAA-compliant specialists, starting at $8 an hour per full-time equivalent. This map shows the integration. Staffingly specialists log directly into the practice's Cover My Meds workflow. AI tools first flag missing clinical information and assemble the documentation, routing it to the human team. Specialists then navigate phone trees, peer-to-peer requests, and complex appeal software cannot manage. By keeping a human in the loop to handle the manual requirements, the practice successfully bypassed payer denial systems without adding expensive internal overhead. We can see the results by looking at the La Jolla practice 9 months after onboarding the new team. The founder's 5-star review noted that the service met their strict operational standards and provided the structured daily status reporting their team required. An operations team member independently confirmed this, describing the outsourced team as an actual extension of their automation stack. Staffingly now supports over 800 providers across the United States while maintaining SOC 2 Type 2 and HITRUST compliance. The financial advantage of this model is measurable. With 0 recruiting fees and 0 benefits overhead, practices see a standard 60% cost reduction compared to in-house staffing. The La Jolla practice demonstrated that prior authorization is an addressable engineering problem, provided you have the right human component in the loop. Partner with Staffingly to integrate dedicated prior authorization specialists into your workflow and unblock your telemedicine growth today.